Hi, this is Dr. Tom Rogers at Performance Medicine, the Common Sense MD. Welcome to the weekly podcast, and I hope everyone had a great Christmas and is going to have a great New Year. I certainly did have a good Christmas, and hopefully it's going to be a great New Year. Hopefully we're going to get rid of some of this COVID mess we've been in for the last 2 years. I personally think it's going to kind of always be around. We'll always have to deal with it, but I think it's going to get less serious and better treatments are coming along. And we're just hoping that some of the things that have happened will not be repeated, and we'll learn from the mistakes that everybody's made with COVID, not to fear COVID. But anyway, let's get on and talk today about something very important. Something that, as a matter of fact, was one of the mainstays and still is because we're still seeing a lot of COVID, um, although hopefully less lethal type, the Omicron, which seems to be less potent. And that's what I'm hoping for, that this virus will kind of, as it mutates, it becomes less virulent and not as dangerous. And again, it's not dangerous if you keep your immune system functioning on your own. And one of the main things that you can do to keep your immune system functioning is a trace mineral that I've been recommending for years and years, especially during the COVID crisis. Can you guess what that is? Zinc. So we're going to talk about zinc today. You know, I've always been promoting vitamin D, C, and zinc. But I want to talk specifically about the wonders of zinc today because a lot of you don't know it. Now, the difference between a major mineral like magnesium and calcium and sodium and potassium, etc., and the trace minerals like zinc and iron and some of the other ones like manganese and some of the ones you've never heard of, is the amount that you need in your body. Now, these all come from food and supplementation, so they're essential that you need to eat them. And you do get zinc from your food, but most people need to supplement with a little bit too, especially if you're getting ill with almost anything. And we'll go over that in a minute. But of course, it's one of the most important nutrients of all is zinc. It's present in all our body tissues. It's necessary for cell division, i.e. growth. It's important for hormone production, um, growth of bones, immunity, we just talked about it, digestion. It manages inflammation. It promotes sexual health. Zinc deficiencies can cause huge problems, and you may not even know you have one, but I'm going to give you some signs to look at or look for in just a minute. Bone mineral deficiencies, infertility, increased risk of diabetes all go along with zinc deficiencies. Hormones. Zinc is involved in the production of estrogen, progesterone, testosterone, the major sexual hormones. And also in men, I put every man on zinc because it prevents their testosterone, which we're replacing, from turning into estrogen. Very important, along with all the other great things that zinc does. But you got to be careful, and I'll get into that in a minute. The most common cause of a zinc deficiency is really inadequate dietary intake. If you look at the RDA, which is the minimal, females need at least 8 milligrams a day of this, and males 11. But most people need more than that, but not too much. You find it in meat, including red meat, poultry, seafood. You find it in oysters. A lot of people have heard of it because of oysters. But also you find it in beans and nuts. There are 2 billion people in the world that are deficient in zinc. That's a lot of people. Higher risk people for zinc deficiency include those over 60 and vegetarians. And if you have signs of deficiency, let's talk about that. because a zinc level is not on a routine lab panel. You can get a zinc level checked. Um, and another interesting way to check for zinc deficiency is really a zinc taste test. I think Standard Process makes them, but you can actually put a couple teaspoons of a zinc solution in your mouth, and if you don't taste anything for 10 seconds, you have a zinc deficiency. If you immediately taste something, you're probably okay. That's not something I do a lot of, but I do check a lot of vitamin and mineral levels through blood testing. But here are some of the signs that you may be deficient in zinc. Have acne, eczema, dry skin, alopecia, that means hair loss of any type, mouth ulcers, stomatitis, which is really a more inflamed lips and mouth, night blindness. This ties into vitamin A, as we'll talk about in a minute. Impaired immunity, as we've already talked about, major. Zinc acts against viruses, think COVID. It heals wounds. It's great for diaper rashes. Zinc oxide is a great treatment for diaper rashes. It's great for bed sores. So there's a lot of great uses for zinc, and you need to think about it. Can you have side effects from it? Yeah, especially if you get too much. Everybody's noticed that if you take zinc on an empty stomach, you're going to get nauseated. I certainly do. If you ever take vitamins and wonder why you're nauseated, it's probably the zinc in there. Some people have diarrhea with too much zinc, but you can even treat episodic or chronic cases, of diarrhea with zinc, and it helps it. And so there's a lot of uses of zinc. It can give you a metallic taste in your mouth. That's another side effect. It usually lowers your cholesterol, including your LDL, but can also lower your HDL a little bit too. And if you took too much zinc, it can make you feel like you have the flu. And it definitely, one of the major things we look out for is depletion of copper. Copper plays an important role in creation of red blood cells and also white blood cells. Some antibiotics can interfere, or zinc can interfere with some antibiotics, most notably quinolones, but also Keflex and tetracyclines. So if you do take these antibiotics, you can still take them, but you need to space it out. You need to take the antibiotic 2 hours before or 4 to 6 hours after you take your zinc. So it's very important. One of the biggest indications of a zinc deficiency is seen in underweight kids and those with stunted growth. They need to think about zinc deficiency. It's also responsible for brain development, so very important in kids. And remember, it's for cell growth, your immune system, your memory, even your attention span. Some people with ADD may think about taking some zinc and see if it helps it a little bit. Reproductive growth. It increases sperm counts. Athletes are particularly prone to zinc deficiencies because they're sweating a lot. And sometimes they don't eat a great diet, and that can certainly lead you to a zinc deficiency. It's been estimated that in the United States, 6% of girls and 10% of boys are zinc deficient. That's quite a lot. So if you're losing hair, think zinc. If you have autoimmune diseases, think about your zinc status. If you have a decreased sense of taste or smell, try zinc. I mean, COVID, hits your taste and smell. When I had COVID, I lost my taste and smell, but just for about 2 weeks. And of course, I take zinc every day. I upped it a little bit during the COVID. So for short periods of time, you can definitely take an increased dose of it. If you have hearing loss, try taking a zinc supplement. If you have acne, like I talked about before, try zinc. If you have vision loss, try some zinc. Zinc helps transport vitamin A from your liver to your retina to produce pigment for your eyes. So think about if you have vision loss or you have night blindness, think about trying zinc out. Wounds that won't heal, try zinc. Chronic diarrhea, as I said before, try a little bit of zinc. Insomnia, zinc actually helps your body produce more melatonin, so think about zinc. Rashes or eczema, think about taking zinc and seeing if it helps it. There's several different forms of zinc, and we'll talk about the doses a little bit. Generally, you shouldn't take more than 50 milligrams of zinc. Some people say 40, but if you take more than 50 for over a few weeks' time, you definitely need to supplement with 2 milligrams of copper. So think about that because copper is very important. The different forms of zinc, I brought a couple of them. This is the form I take. This is zinc. What's it? I think zinc citrate. It is. That's the one I take. Zinc citrate with food. Remember that. Here's another interesting form. This is zinc acetate, but this is in a lozenge. I keep these handy if I got a cold, or certainly I took them when I had COVID. They just dissolve in your mouth, have a low dose of zinc in it. So I like these a lot, and they're good. But there's also zinc gluconate. It's probably the cheapest form. It's not absorbed as well as the zinc citrate, which I like. If you can get it, there's zinc orotate. That's a good one too, very well absorbed. Zinc picolate is also good. Zinc sulfide is good too, especially if you have acne. Think about that. Zinc oxide, don't take that orally, but you can put it on the rashes. Zinc oxide is the best form for rashes and also blocking out sun, as you know. So there's a lot of different forms of it. They all work, but I like the life extension stuff. I've always used it and got great results from it. So think about, especially during this winter when other viruses are going to hit. We're still in a COVID pandemic and it's surging. We treat multiple cases every day, and one of the first things I do is put them on zinc. The reason that some of these medicines work, like hydroxychloroquine and quercetin, specifically those two, is because they act as ionophores. And what that means is they act to get the zinc down into the cells. They're the transporter, and the zinc kills the virus. So zinc's very, very important. Think about adding zinc to your regimen. This is Dr. Tom Rogers at Performance Medicine. Any questions, please don't hesitate to call or look at our website, performancemedicine.net. I'll see you next week.